19. We also have with us Dr. Shaw, Executive Director of Harris County Public Health, and Rick Campo, who is the Chairman of the Port of Houston Authority. They will provide an update. Following their remarks, we will be monitoring the live stream via Zoom for any questions that come in. I will come up to the podium and pose your questions. We ask that any media asking questions via the Zoom feed, please provide your name and your media affiliation so we can be clear who is asking the question. Okay, with that, I'm going to hand it over to Judge Hidalgo.
Let me begin by first thanking each one of the businesses, the restaurants, the malls, retailers, workplaces who are helping us take social distancing seriously, helping people stay home, who are sacrificing to put public health and safety first. And this is not an exaggeration. By taking the steps you are taking, you are putting health and safety first, and you are helping save lives. I know it's not easy, but we see you stepping up, and we thank you for it. And we thank every single resident of this county who is working to stay home, to stay away from crowds. I can see folks following those instructions, and we continue to need even more of that, because what we can control right now amidst all the uncertainties is trying to keep our distance from one another, minimize unnecessary contacts so that we're not spreading the virus and we're stemming the flow of that. As you guys know, as of this morning, last night, we had 18 cases in unincorporated Harris County. We have one more that Dr. Shaw will go over that came in just this morning. Yesterday, the city of Houston announced five more just in one day. The rates are increasing. This is here right now, and we have got to double down and do our part. In the meantime, remember to support our restaurants, our businesses who are taking these steps. Order online, drive-through, pick up. Again, no crowds, but do support these establishments. I want to make an announcement related to the impact that this has had on our community. Of course, these are all jobs, and that's why it's so difficult for us to take these steps, but we do it in the name of public safety and making sure we do everything we can to avoid a situation like Italy or what other parts of the country are seeing. And so one of the steps we've taken and we're taking today is around evictions. Today, the Justices of the Peace in Harris County are prepared to announce, or they will not conduct eviction hearings through at least the end of March. So to repeat, the Justices of the Peace in Harris County will not be conducting eviction hearings through at least the end of March. We're continuing to work with them to extend this for however long our community needs it. And if needed, I am willing to sign an order to continue to ensure that this takes place. I want to point out, of course, as exigent circumstances, domestic violence, violent crimes, but generally, we don't want people out on the street simply because they're out of a job because of the coronavirus, and now they're losing their homes. And so first I want to thank, of course, our Justices of the Peace, the 16 leaders who have stepped up on this, the Apartment Association with whom we've been in close touch, and all the members who understand the importance of this and are stepping up as well, the community advocates who've helped make this possible, and everyone who helped implement it. This is a matter of safety. It's not just a problem on the economic side for families, but this is also not the time to be putting people out on the streets. This is the time to remove obstacles in the way of families dealing with school closures, with job losses, with the unprecedented disruption to daily life. And we know that this is a primary way to make sure that we are stemming the spread of the virus, because we're asking everyone to stay home, and we need them to have a home to stay at. And so I want to just thank again everyone who's been working on this. Today, my message continues to be simple, and that is stay home. We need people to help with us. We're in a critical window of opportunity where we can either contribute to the spread of this virus as we see it quickly speed up in its spread, or we can help stop it in its tracks. I've discussed before how we still have not received the federal materials we need to truly increase significantly our testing capabilities. We are working with the hospitals to maximize their capacity, but we know no matter what they do, we will never have enough capacity to sustain the kind of increase that could take place in this community. And so what we can do, what is in all our hands, is to ensure that we're not passing along the virus, whether it's folks who are at high risk or it's young people. This is not the time to be at the store, to be at the mall, to be in groups in any kind of setting. For a house party, this is not the time for that, and we need everybody's help with it. So please, unless you absolutely need to purchase necessities, and in that case, ensure you stay 6 feet away from people, please stay home. Finally, let me share another life-saving resource that's now being made available, and that is a mental health resource. We know that this is a difficult time for folks. It's hard for us to stay home. We feel lonely, our lives are disrupted, and so it's a challenge on the mental health side. The Harris Center has activated a mental health line that's available to the public. You can find the information for the line and all other kinds of resources, like how to volunteer, how to report businesses who are not complying with our order, how to frequently ask questions, rumor control, all kinds of resources at readyharris.org, and the mental health hotline 833-251-7544. Now, I do want to make a note on the situation at the port, and Chairman Campo will be here giving the fuller update and answering any questions as well. But let me just say that, first of all, our port and the purpose it serves is essential. They're not going anywhere, and we need them to continue to ensure that we receive the goods and services. We have been notified of a worker who was at both terminals that the port maintains and operates, and so Chairman Campo has opted to close those down temporarily while the situation is sorted out. Remember, delays are built into the supply chain. We routinely face issues with weather, fog. We routinely see, goods take about a month to arrive from certain places, and so delays are built in, and we are working to get this up and running as quickly as possible. Cargo ultimately flows like water. It'll find a place to go, and we'll make sure that our community is receiving the goods it deserves. So I want folks to know we are wholly focused on getting the terminals back open, and for now, at least in the short term, the impact is in a way already factored into the system, and so that buys us time to get this work done and ensure that there aren't severe disruptions. And so with that, let me repeat my remarks in Spanish, and then I'll welcome Dr. Shaw and then Chairman Campo to give their updates, and we'll take questions. En español, primero quería agradecerle a todos los negocios, los centros comerciales, todos los restaurantes, bares, las personas que nos están ayudando al no promover grupos de personas, al cerrar y realmente tomar los pasos que todos nosotros debemos tomar para prevenir el contagio de este virus. Sé que es difícil, sé que muchos están sufriendo económicamente y quiero agradecerles a todos esos negocios, también a todos los residentes, todos esos de nosotros que estamos trabajando por no salir, por no estar en grupos, por decirle a nuestros niños que por favor no salgan, no inviten grupos de gente, porque sabemos que este virus está creciendo. Simplemente el día de hoy ya tenemos 19 casos en el condado Harris, fuera de la ciudad de Houston, uno más esta mañana, del cual hablará el doctor Shaw. También la ciudad de Houston ayer anunció 5 en un solo día. Los casos están creciendo de una manera muy rápida y, como he mencionado antes, nosotros no tenemos todavía los materiales que nos ha prometido el gobierno federal para poder incrementar sustancialmente el número de evaluaciones, de pruebas que hacemos en la comunidad. Los hospitales están trabajando por maximizar su capacidad, por asegurar que tienen la cantidad de camas máximas que puedan crear, trabajando con el condado, con la ciudad, pero la realidad es que si vemos un incremento tan drástico como se ha visto en otros países, no hay nada que podemos hacer para tener la capacidad para todo ese número de casos. Entonces, por eso lo que sí podemos controlar, lo que sí podemos hacer nosotros es no exponernos ni exponer a otras personas a ese virus. Sabemos que podemos cargar el virus y no tener síntomas, que aún las personas jóvenes y saludables pueden contagiar a las otras personas y necesitamos todos seguir poniendo de nuestra parte para no contagiar a la demás gente. Por mientras, ayuden a apoyar los restaurantes, ordenen de ellos, recojan comida. Si necesitan salir a comprar medicina, a comprar algo pues necesario, tengan cuidado de tener una separación de 6 pies. Como hemos visto, el impacto económico es muy fuerte, es necesario dada la situación de salud, pero igual es muy difícil para muchos. Entonces, hoy quiero anunciar algo en cuanto a los desalojos. Los jueces de paz han decidido que no habrán audiencias de desalojo por todo el mes de marzo. Estoy trabajando con ellos para extender esto hacia abril y finales de abril y estoy preparada a ordenar el que continúe esto hasta abril si es que ellos no lo hacen. Entonces estaremos asegurándonos que no hayan desalojos al menos hasta entrado el mes de abril. En este momento le estamos pidiendo a todos que permanezcan en casa y no podemos permitir que las familias estén fuera de sus casas. Entonces es algo pues por el lado de la salud, también por el lado económico y entendiendo que todos tenemos que trabajar juntos en esto. Quiero agradecerle a la Asociación de Apartamentos, han trabajado conmigo en esto, han sido increíbles en apoyar esto. También agradecer a los jueces de paz, a los activistas que han trabajado y los académicos que han trabajado con nosotros en este paso. El mensaje más importante el día de hoy es quédense en casa. Seguimos con ese mensaje. Pedimos que todos nos ayuden. Estamos en un momento increíblemente crucial para o continuar expandiendo el contagio de este virus o detenerlo. Y la única manera, lo único que podemos hacer hoy día con los recursos que tenemos en este país, en este condado, es el separarnos, el no contagiar los unos a los otros. Entonces, por favor, recuerden no salir en grupos, no estar en grupos en casa, nada de ir al centro comercial, al gimnasio, a ningún sitio donde estén en contacto con más gente. Aún las personas saludables pueden contagiar a otras y están creciendo los casos, por lo que no tenemos suficientes pruebas. Sabemos que hay muchos más casos por cada caso que les reportamos a ustedes. Otra cosa que hemos hecho el día de hoy y que quiero compartir es un recurso para la salud mental. Sabemos que afecta la aislación, causa ansiedad, causa depresión, pues los trabajos están causando muchos problemas para todos, no solo económicamente, sino también salud mental. Entonces, el Harris Center, que trabaja en la salud mental para el condado, ha creado una línea de apoyo. La pueden ver en readyharris.org. Allá también pueden reportar negocios que no estén obedeciendo nuestras órdenes, pueden ver rumores que existen y cuál es la realidad de los rumores, pueden ver cualquier tipo de información donde pueden hacer voluntariado seguro y la línea, como les dije, está en readyharris.org o también el 833-251-7544. Finalmente, Rick Campo, que está aquí, va a hablar acerca de la situación en el puerto. Sabemos que hay 2 terminales en el puerto y nos hemos enterado ayer que hay un trabajador con el virus quien trabajó en ambas terminales. Entonces, él ha decidido cerrar ambas terminales por mientras aseguramos que no hay ninguna otra persona que haya sido contagiada, expuesta al virus. Y le quiero comunicar a la comunidad que los retrasos son parte del sistema. Muchos de estos bienes tardan un mes en llegar. Muchas veces hay que cerrar las terminales o bueno, hay que retrasar los envíos por clima, por temas fuera de nuestras manos. Entonces, esto no es algo que va a cambiar la disponibilidad de materia prima, de recursos. Aquí, el día de hoy, estamos trabajando muy rápidamente con el Departamento de la Salud Pública, para poder abrir las terminales y prevenir que esto suceda en el futuro. Entonces, con eso voy a invitar al Dr. Shah y después a el líder de nuestro puerto de Houston, a Rick Campo. Thank you so much. I'll now invite Dr. Shah to the podium.
Thank you, Judge. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health. I'm also the local health authority for Harris County. And I just want to thank the judge for providing opening comments where she has really provided all the essential updates, but I want to just add and echo a few additional points. First of all, as she mentioned, these are unprecedented times for all of us. We know how difficult this is for our community. It's difficult for all of us. It's been a challenge for the kinds of things that we've been both watching in the news across the world, but also now seeing things in our own community. We recognize how difficult that is for all of us, all of our community members. And so I just wanted to reemphasize the fact that we're in this together. And this really requires all of us to work together. And that includes those activities that we have been saying from the beginning, which is all the things that you can do to essentially assure that the people that are around you, especially if you're sick, that the people around you are protected, that you do not infect someone else. At the same time, we want to make sure that we are doing everything we can to limit the amount of people that are in close contact and gatherings. The judge mentioned that as well previously. There are a lot of efforts that we at the county have given in coordination with our other partners across the region to really recognize that we have to do our best to slow this virus down. Slowing the virus down gives us the best opportunity for our healthcare system and all of us in the community to be able to handle a potential surge of individuals that may be either very sick or requiring hospitalization or requiring more intensive levels of care. So that's absolutely critical to what we're attempting to do. So everything that we have been working towards over the last few months, but especially the last few days to weeks, is really about slowing the virus down. It's about flattening the curve. And I do want to make mention, as the judge recognized, that Harris County Public Health had confirmed that we had additional cases yesterday for novel coronavirus. The city of Houston also confirmed additional cases yesterday evening, and now we're confirming an additional case this morning. That brings our total to 19 cases, confirmed cases, in the Harris County Public Health jurisdiction outside of the city of Houston. And with the city of the 10 cases they have at last count, that gets us to 29 cases for Harris County as a whole. And that's not inclusive of other cases in the region. About the individual that was confirmed, that I'm confirming now, this is a 40 to 50-year-old male, no history of travel, no history of exposure to novel coronavirus. This is an individual who's hospitalized. He's from the northwest quadrant of Harris County. And our concern, of course, is the hospitalization, really at the end of the day, the recognition that this is not novel coronavirus, that we have been talking to our community and all of you about the fact that a very good portion of people may be without symptoms, or they may have mild illness, or they may be home after they get diagnosed. But now we're starting to see individuals who are hospitalized, and even from some of our couple of cases that we diagnosed or confirmed over the last couple of days, they're actually in more difficult circumstances in the hospital. So I want to just make that known that it's not just about getting a novel coronavirus, COVID-19, and moving on with your day, that we are very concerned, especially about at-risk populations, those who are seniors, elderly, those who have underlying medical conditions, those who have compromised immune systems, pregnant women. These are individuals in our community that novel coronavirus has shown across the globe having more impact. And so we have to do everything we can, the rest of us, to assure and do our best so that we can protect others around us. So this is really why the community is so critical to this effort. I did want to also make a couple of more comments. One is about the port. Our team is working very closely with Mr. Campo, and we really appreciate, Mr. Campo, your leadership and your partnership to really continue the investigation and really understand better what the degree of risk is at the port. We're still in the midst of that investigation. We recognize the importance of the port to our community, and we're doing everything we can to work through that as quickly, efficiently, but also as thoroughly as we can. So I wanted to make mention of that. And then the other thing I wanted to say is that the judge absolutely emphasized the importance of the mental health aspects and the anxiety aspects of what's happening. So we know that life as we have known it has changed. Even in this room, there used to be a lot of our media partners with us. Now we're doing a lot of this by video conference or by feed. And it's important for us to remember what we used to see in restaurants or in bars or all across our community. Life has changed. And we know that is one that we have to all cope with, but we also have to recognize the importance that, especially for some individuals, that is very difficult, especially when we think about what our children are seeing in images. So one of the messages that both Harris County Public Health, and the Harris Center for Mental Health and IDD, what we're wanting everybody to know is, one, there are resources available. The judge mentioned through readyharris.org, there are a number of resources that are available that the Harris Center has put up. We also have been recognizing the absolute importance that we have to take some mental health breaks ourselves. We have to do everything we can to boost our immune systems and sleep and assure that we're taking our vitamins and we're getting all the rest we can. But we also have to do our best to, at times, take a break from all the news that we're hearing about novel coronavirus across the world, and really make sure, especially our children, are taking that break to be able to cope with things at home. And whatever you can do in your homes with your children, your young ones, to be able to help them get through these difficult times. They have never seen these times before, and honestly, many of us, most of us, haven't either. But we have to do our best to work together with our families and really those that are the most youth, our youth in our homes and our communities. And then the final thing is around the judge's discussion around evictions. I do want to say that we are recognizing the absolute importance of that work. It is very important from a health standpoint that we do everything we can to really help our community during these difficult times, and whether that's from an economic standpoint, from waivers or some exemptions of certain activities or issues or challenges. We want to do everything we can to help our community through these difficult times. So again, I want to thank all of you for all the wonderful things you have been doing. Our healthcare partners, especially, I want to thank our frontline healthcare workers, our first responders, all of the individuals that have been really working so closely with all of us in government, our community members, and really everyone who is in this fight against novel coronavirus. We will get through these difficult times, but it's going to take some time to get through these, and we have to do it together. Thank you.
Well, thank you. I'm Rick Campo, the chairman of Port Houston. I'm also, in my day job, chairman and CEO of Camden Property Trust, an apartment company, so I'm going to address the eviction issue here after I discuss the port. But first of all, I want to thank Judge and Dr. Shaw for their leadership through this situation, this unfortunate and complicated maneuvering. Last night, the Port Houston received information that we had a worker, an ILA worker, that tested positive for the coronavirus. We have a task force that is focused on making sure that cargo continues to flow through the port. We had conference calls last night with the governor, lieutenant governor, the mayor, county judge, and other state officials and federal officials to make sure they knew what we were doing. We, in an abundance of caution, have closed both Bayport and Barbers Cut. Our first priority is safety, and for our workers and for anyone who comes in contact with the port community. The port is an essential business that has to operate. We have to bring in cargoes that everyday Houstonians and people who live in Harris County need. So we recognize that it's critically important to open the port as soon as we can. A couple of details. So that we had one worker that tested positive. He worked at Barbers Cut over the weekend and 9 days ago at Bayport. The good news is he had, we think, limited contact, and he wasn't a full-time port employee, so we have short periods of time that he was at those two facilities. So our protocol, what we're doing to go forward and to open the port as fast as we can, is we're doing investigation in conjunction with the ILA, with Harris County, and with our own port police and port fire.
Perfect, thank you. Oh, that's much better, much better, okay. All right, so now that you can hear me, let me start over. So I'm Dr. Umair Shah, the Executive Director of Harris County Public Health, and just to answer the question about elective surgeries, there have been a lot of moving pieces related to elective surgeries and procedures across the system, not just what's happening within our healthcare hospital system, but also in outpatient clinics, including in medical clinics as well as in dental clinics. We recognize that those providers who are, again, as I mentioned, are frontline providers who are providing care that there's the challenge that we're trying to balance is the provision of that care for our patients while we're also, one, protecting the very patient that is getting that care, the provider who's providing that care, as well as preserving the limited personal protective equipment, including masks and gloves, et cetera. So it's a balance that is really in place that everybody is trying to strike. While we are not making a formal recommendation to our providers, we are also working with our providers, including both in the medical and dental communities, as well as the veterinary community, to really get information out about what the guidance has been from other partners, whether associations or federal state guidance, as well as local regional guidance. And really, I think the main message is that if you're a patient who has a procedure that you feel can be postponed or rescheduled, please contact your healthcare provider, your dentist, and ask that question. Is this something that needs to happen now? And if the answer is no, then we would ask you to forego that procedure to a later time. At the same time, we're talking to our providers and asking our providers to do a very similar calculation. Does this procedure need to happen now? Is this something that I can forego? Can I reschedule? What is the potential risk benefits of providing that procedure? We're particularly concerned about dentists and the surgeons, particularly ones that do procedures that are of respiratory in nature in some way that allows for some additional aerosolization, if you will, with the procedure that they are engaged in. We know that many doctors, many dentists have already taken steps. They've already temporarily closed their offices for 2 weeks. They've already taken the appropriate steps with additional PPEs. If they've not closed their offices, they've already contacted their patients. So we are not making a formal recommendation, but we encourage that patient-provider relationship. We're also asking the state and our boards, as well as the associations, to really look at the science and the evidence to make sure that we protect not just our patients, but our providers. And so we are encouraging our state associations and state boards to really look at the science and to make sure that we are giving that appropriate guidance to our medical and dental professionals.
Thank you, Dr. Shaw. We've received several questions about testing from Houston Public Media. Are any county testing sites expected to delay openings due to people showing up early because of misinformation? From KHOU, I'm going to group these together because they're related to the same topic. Yesterday, the White House asked that elective surgery, we will soon, actually, hang on. There is free testing at Representative Sheila Jackson Lee's event today. Private clinics are doing testing, but so far the county has not launched its public drive-through testing. Why is that? When will it start? How will screening work? New York's governor says they've tested 8,000 people so far in the last 24 hours. Texas Governor Greg Abbott said the other day that 1,264 tests have been done so far. Where are our tests? How many has the county done so far? And finally, from Emma Whalen at Houston City Hall reporter for community impact, Dallas and Austin set up free drive-through testing sites earlier this week. What was the cause for delay in opening Houston's free sites?
So very important questions about testing. We've been talking about for the last week at least about the first, the commitment to making sure we get testing up and running, and second, the need for materials for that to happen. So as folks know, there are 4 sites that we've, ideally we'd like a lot more than that just for the size of our community. But given the materials that we believe are coming from the federal government, we would have enough for 4 sites at various places throughout the city of Houston and Harris County. And that's what we continue to drive toward. To the question about people showing up and delaying the opening of the test sites, I don't believe that has delayed the opening. I will say, we need folks to not come to the testing sites that are being built because, again, we're trying to keep social distancing, and it will help us continue our work if we don't have, if we can focus on that. And so we need help from the press explaining those are not open right now. There was a question about how it would work, and so we are building and have built a triage system. We won't have enough tests for everybody, and so how do we prioritize in a system for folks to be initially evaluated so we can direct the most crucial cases, folks, for example, who are healthcare workers or who are certain to have come into contact with someone who had the virus, those go at the top of the list, and so on and so forth. And so the systems are there, and we're just waiting for the materials. That's really the backlog. There are private labs that are doing some testing. There's another one, as y'all said, that is opening today. If you guys look at the numbers, it's still very, very limited. Just over 1,000 in all of Texas, when we know just Harris County is larger than many countries. South Korea has capacity to do in the tens of thousands, and so we are very behind on just supplies, and we will get those open as soon as we get our supplies, as soon as we were able to receive those from the federal government. We have some locally that we're working on opening, but the question, and also when you look at those other communities, is, yeah, they open a site, but it's very, very limited. And so I don't want to create false hope that we are ready right now to have a radical increase in testing. We are unfortunately not, because we do not have the PPEs, the test kits, the reagents, and we're working on getting those. We need them to arrive, and there's right now in the country, we haven't been able to ramp that up sharply. So these efforts are welcome. They're important. We are supporting them. Our focus is on trying to get our efforts as big as we possibly can make them. And so, as I said before, what we can control is the social distancing, is making sure that we stay home. And we are continuing to run down the testing, knocking on every door to get our supplies. But the reality of it is the increases we're seeing are very small, even in the other states and cities that were mentioned, is very, very small. So that's right now is not where we have seen the big change. Where we can make a difference is by staying home and not exposing one another to the virus, and be sure that we're continuing to fight to get our supplies and get a significant number of tests as soon as it's humanly possible. Dr. Shah, anything to add?
Judge, actually, you've covered it. The only thing I want to add is the fact that our last few cases, and again, if you go to our website, you'll be able to get this information on our website, that we do have individuals who have been confirmed as cases where we do not have evidence that they travel, we do not have evidence that they were in known contact to a case. And so that really is moving from initial concerns about community spread to now having community spread. And so I cannot emphasize enough 2 points that the judge made. One, that it's not about a test, it's about an evaluation process, which includes being at home and all the things that you can do to say, what's the credible information, what's the likelihood that I need to be concerned or my family needs to be concerned. And number 2 is all the steps you can take today to help slow the virus down. And that really means, again, social distancing and really limiting your gatherings and really being especially meticulous, almost as if assuming that you have the virus, how would you protect yourself by not infecting others? Those are the kinds of steps that we want people to take right now to really assure themselves and the people around them that they're protecting everyone in our community.
For Mr. Campo, can you repeat what needs to happen before the port is reopened, and when do you think that might happen?
So what we need to do is we need to investigate the interaction that the employee had or the worker had with other workers, and that's happening right now. We have meetings with the ILA, with Harris County, and with Port Police and Fire, and they're doing that investigation now. And it's basically talking to the people on site and also talking to the worker and determining what his path was and how many people he actually interacted with. The good news is that he was a truck driver, so he spent a lot of time in the truck alone, which is good news. And then at Barber's Cut, he was a lift operator, so he wasn't interacting sort of all the time with people. He did interact with some, and what we need to do is make sure we understand who he interacted with, when he interacted with those people, and what kind of interaction that was. And that investigation is going on right now with all the right players, doing that as we speak. As far as how long the port could be closed, we don't know the answer to that yet. We don't think it's a long time. We think it's days rather than weeks, and we will make sure that before we open, we will have safety as our primary focus to make sure that our workers that come back to work are safe and that we can operate the port in the most responsible way. And I think that really is the ultimate key. And as Judge said earlier in her comments, the shipping business has a lot of flex in it. They have weather conditions at sea, weather conditions when they come into port that can delay shipments when we have fog. And we had fog a couple days last week, and where ships couldn't come in. So there is a certain amount of flex in the system. So I think the fact that we have this flex built into the system, cargo will flow ultimately, and I think we'll not disrupt the supply chains with things that are going on now.
From the Texas Tribune, Mayor Turner tweeted that there will be no shelter in place in Houston. What's your opinion on this policy? And secondly, from the Texas Tribune, Governor Abbott has been criticized about creating a patchwork of policies and not having uniformity in his response to COVID-19. How is this affecting Harris County, and what are you trying to do to solve it?
Look, honestly, it's very important, as folks can see and is obvious, for us to work very closely together across all jurisdictions in our response to the virus. I can tell you I've been working extremely closely with Mayor Turner, and we've been very aligned, and we'll continue to work for that to go forward as it's been. Been working very closely with KP George, Fort Bend County Judge, with Judge Keogh in Montgomery County, and so those relationships are crucial, and we'll continue to work together so that there's consistency. As I've mentioned before, we can't hermetically seal Harris County. We are not an island, and so we want to make sure that our neighbors in an area that is urban and suburban and even borders on rural and some counties, we want to try and have consistency to the broader extent possible. I know that the governor is in conversations about what decisions he will make, and I'll be looking out for that, any further announcements from him. So far, we've received a lot of support from his team in whatever the state can do to ensure that we have the resources we need, and a lot of it goes back to federal resources that we're still expecting and hoping for. And I do want to thank my colleagues in Congress for the package that they've been working on with the president. As far as the question on the shelter in place, we are exploring all kinds of policies right now. I am in constant communication with experts, with leaders in other communities. We are looking at other countries. We're looking at other cities and states and trying to pull out what is helpful and relevant for our region. We have got to be flexible. We've got to be smart. We can't be catching up. If we do the exact same thing they've done in other places where they already overwhelmed the healthcare system, we know where we're headed. We have to get ahead of this. We have to do better. That is what I'm committed to. And that means making difficult decisions, like the decisions we made yesterday, like the decisions we continue to make today, the decision Chairman Campo has made. But we have to be aggressive about this, and that's where I'm at. So I will keep the community posted as we figure out our next steps. But for now, I'll say what we need you to do is to stay home, and we can't micromanage our population. We need each person to play their part, and the way we do that is by ensuring each of us is keeping a distance and not participating in any kind of activity or encouraging any kind of activity where there may be people gathering at all. That should just not be taking place. So that's where we are right now.
And we'll do one or two more because we're coming up on 1 hour. From the Katy Times, residents in Katy are concerned that having a testing center at Legacy Stadium may bring people with symptoms to local businesses and add to the risk in Katy. Is there an increased risk if residents are near a testing center?
Thank you for that question. There is not an increased risk if you're near a testing center. These testing centers, as they've been designed throughout other communities, and including the testing centers that we're designing here locally, are testing centers that are meant to be drive-through, that they're meant to be somebody in a vehicle who's going to be driving through and coming on the grounds and then moving forward with the specimen collection and then leaving out of that area. So these are not designed to be walk-up. These are not designed to be walk-in. These are also, as the judge mentioned earlier, that we want the individuals that are going to be there they have to be triaged there. So it's not that somebody can just walk there or even drive there and say, okay, I'm here to be tested. That's not the way these centers, the drive-through centers, are designed. They're designed to be triaged, that you get an authorization to be able to go there. And once you go there, it's really by vehicle. And so anybody that's in the surrounding area should not have concerns of individuals coming through, because again, they would be just as you would have anywhere else in the community, somebody in a car, a vehicle who would be coming through, getting the specimen collection done, and then going on their way. So I just wanted to reemphasize that the risk to the community around these specimen collection sites is not there.
From Houston Public Media, the second coronavirus aid package was signed by President Trump last night. Will Harris County receive any funding or resources through this act? And as a follow-up to that, case numbers examined by NPR appear to indicated the notion that COVID-19 is only a serious threat to older adults is wrong. Would the way the outbreak has played out in Harris County and Texas support that conclusion?
On the question about the aid package from the federal government, we're still making our way through it. Harris County, unincorporated areas, would be the 5th largest city in the country after Houston. And so it's very important that part of that aid come to Harris County. Of course, if you count Harris County as a whole, we are larger than 26 states the size of Colorado in population. So we are advocating and we hope and believe that our legislative partners will help ensure that those funds arrive in Harris County as well. So we'll continue those discussions and keep the community posted. In terms of the other question, Rafael, the second one?
Had to do with the notion that it's only
So there was a question about whether COVID is only a threat to older folks and what the data is showing. And look, we're all learning as we go along what the science tells us about this virus. I know there are still questions about, will the virus go away in hot weather? How long does it last in surface? All of these questions the scientists are working to answer. And that's why we've said all along that everybody needs to stay home. And it may be that, and certainly is, that folks with certain conditions are at higher risk. And I think we're we're all but certain that folks that are over 80 are very high risk, and it lowers somewhat as you get younger. But we can all expose those people. And so in Harris County, we've seen folks of all ages affected. We've got folks in their 20s to folks in their 70s, and I think beyond that. And that's why all of us have to be part of this, including people who are young and healthy. And whether or not they themselves will end up falling ill and needing a hospital bed, to some degree, that's not the emphasis. The point is they can also, whether or not that happens, they can still pass on the virus to other people who would end up falling sick and needing a hospital bed, whether it's because of their age or their conditions. And so going back to the message, stay home, don't participate in social activities of any kind.
All right, just one last round of questions on the port for Mr. Campo. The ILA worker who tested positive for COVID-19, is he currently in quarantine right now? And did I hear he is a part-time truck driver with the Port of Houston Authority? Is there also any reason to believe anyone else might have been infected at this time? And are those individuals currently in self-quarantine? Related to that, what will happen to the vessels scheduled to stop at the port? Will they be diverted? How many vessels are expected to come to the port in the next few days?
So to the first part of the question, the ILA worker is in the hospital and is, I understand, doing well. The second part of the question of do we know if anyone else had contact and were in fact infected? We do not know that now. That is what the investigation that is going on as we speak will determine. We hope the answer is no, but we don't know the answer, and we'll get you the information once we have it. The number of ships that come in, when you think about the container ships, they're about 14% of the total ship transits through the channel. The Port of Houston manages 8 terminals, and the 2 terminals that we have closed are Bayport and Barber's Cut. The other terminals are open, so other things that are coming in, like steel and what they call break bulk, which are things that are not in a container, are still continuing to flow. All of the industry, when you think about the other 86% of the ships, are energy-related ships, either in or out, bringing energy in or taking energy out, and those are continuing to flow. The only ships that aren't flowing are specific container ships that come and call on Barber's Cut and Bayport. And we know that there are several ships that are actually at the dock that are unable to leave at this point because they haven't been unloaded. We hope to get those folks on their way once we complete the investigation and ultimately the cleaning and opening of both of those areas. Thank you.
Thank you all for being here, and thank you for the questions. We'll continue to answer these as they come in. Thank you.